Were you ever afraid for your health or concerned or, apathetic about it,
No, because it's not contagious, Dan. That's the key. It's not contagious. When it gets into mammals, and it gets into all kinds of mammals, dogs, cats, sea otters, everything, when it gets into mammals, it takes a different form, and it is never, the only exceptions are unusual things, but it isn't contagious from one mammal or one person to another. So I was never worried about myself. I was worried about the patient.
Those were the words of Dr. Tom Larwood. The history of valley fever, also known as California fever and desert rheumatism, among other names, is long and devastating. It was first discovered in 1892 by Argentinian medical student Alejandro Posadas. He cataloged the severe dermatological problems of a soldier over the course of nearly 3 years. The soldier had contracted a fungal rash on his cheek, and the then unknown valley fever took his life 7 years later. During this time, Posadas succeeded in transmitting the infection to several other mammals. Posadas' next patient came a year later from the San Joaquin Valley, a laborer by trade. He exhibited symptoms similar to those of the soldier. This patient lived until 1895, when an autopsy revealed extensive and consuming fungal infection. A surgeon at the hospital experimented on the laborer and determined that the disease did not spread by physical contact. By experimenting on small mammals, he determined, erroneously, that it must be subcutaneous. The disease was named by that surgeon's co-author, T. Caspar Gilchrist, in 1896. He concluded that the organism was a protozoan, not, in fact, a fungus. He subsequently named it Coccidioidomycosis because it resembled coccidia. 4 years later, William Ophulis and Herbert Moffat grew a mold in culture and managed to infect small mammals with it, proving it to be a fungus that existed in two forms, not a protozoan. Ophulis showed the two different stages in his studies, and in 1905 published all the available information about the disease, which he called coccidiogranuloma, and hypothesized that rather than subcutaneously, the infection came from inhalation of the organism. In 1929, a student studying the disease at Stanford accidentally inhaled a culture of spores and became severely infected. His death seemed imminent, but he gradually began to recover. How could this be? In 1936, Myrnie Gifford noticed similarities between valley fever and siamitis when she was studying the fever, and noticed similarities between the student's case and cases of the fever. This realization led to the discovery that most patients had had a history of particle exposure. The domain of siamitis was found to be Kern County, specifically the city of Delano. It's worth noting that a member of our group, Dan, is from Kern County and has likely been exposed to valley fever himself. The following year, in 1937, Charles Smith began a 17-month study of the disease and found that most of those stricken were migrant workers from the 1930s Dust Bowl. He studied the effects of prolonged exposure to the fungus and found that direct exposure was a requirement for the symptoms. Because outbreaks of the disease proved to be so incredibly devastating, it was considered for use as a biological weapon by the U.S. military in the 1950s and 60s. It was, however, determined to be too deadly. We'll now talk about some of the symptoms associated with coccidioidomycosis. Our Argentine soldier exhibited all of the symptoms of valley fever. He had a large, purple, fungal-like mass covering his right cheek. He also had several ulcerative vegetations on his nose and arms, along with severe papules. Fever and lesions occurred repeatedly over the course of the 7 years he was infected. In addition to these symptoms, sufferers of valley fever also experienced severe joint pain and loss of strength. Chronic headaches, pneumonia, and meningitis are risk factors as well. If the person is lucky, the symptoms will go away on their own. About 60% of those infected are able to fight it off naturally. The spores will still inhibit their body, and always will, but then help to build a resistance so that the symptoms themselves never come back. In some cases, doctors may not be able to figure out what is happening. The fever can run rampant on its host and cause debilitating pain and suffering. In the 2012 case of Berenice Parra of Bakersfield, California, doctors could not figure out what was wrong with her. She suffered for months and endured unnecessary knee operations because they thought she had a tumor that was causing her joint pain. She contracted meningitis as well and was surely dying before they diagnosed her with valley fever. Even after treatment, she still lives in constant fatigue and has chronic headaches that cannot be cured. When the fever does not subside on its own, antifungal medications are used, most commonly diflucan and itraconazole. Coccidioides have two different life cycles, saprophytic or parasitic. Spores that live a saprophytic life cycle sustain themselves in dirt, essentially. They grow as mycelia in dirt, then mature and multiply. They can then become airborne and convert to a parasitic life in their host. Usually, though, spores that enter a human host are underdeveloped spherules. They then mature and multiply inside of the host, as the lungs are a very habitable environment for the spores. They will continue to multiply and cause issues for the host until an antifungal is introduced. Today, valley fever still affects those living in the southwest United States. Valley fever thrives in dry areas, which is why the Southwest is at risk year-round. The most at risk tend to be those with dark skin, African Americans, Filipinos, Hispanics, etc. Pregnant women, the elderly, those with diabetes, and weakened immune systems are also at high risk. Though valley fever may seem like a thing of the past, around 70 deaths occur annually in the state of California. During 1998 through 2013, documented cases have increased drastically. Why might this be? There have been no conclusive answers, but it likely has to do with the environmental soil change due to human interference, construction, for example. Humans aren't the only ones who find themselves stricken by valley fever. Animals are affected as well. Cattle and livestock can be infected with it, but it's not commonly the cause of their death. There have been rare cases of fatal infections in horses. Llamas are very sensitive to the spores, however. Apes, monkeys, and many zoo animals are highly susceptible as well. The spores aren't limited to land areas either. Marine mammals like sea otters and dolphins can be afflicted with valley fever. In Ohio, we don't exactly have to worry about falling victim to valley fever. Be wary, though, if you ever visit the southwestern United States, Mexico, or South America.